Hello, everyone. This is Cheryl Musial, and welcome to PATHTalks. In our upcoming episodes, Pathway Health experts and other industry leaders will share their valuable insights and resources focused to inspire today's healthcare leaders. In this episode, Pathway Health's Chief Nursing Officer, Susan LaGrange, introduces Geri-Res Nurse Residency Program. Let's listen in.
Hello and welcome. My name is Sue LaGrange. I'm the Chief Nursing Officer at Pathway Health, and I would like to welcome you here today. I am here with very talented professionals who developed Geri-Res. Dr. Barbara Bowers, Emerita Professor and the Founding Director of the School of Nursing Center for Aging Research and Education at the University of Wisconsin-Madison, and Kim Nolet, a Research Implementation Manager from the University of Wisconsin-Madison School of Nursing and manager of the Geri-Res Nurse Residency Program. Welcome to our discussion today. We will be discussing the Geri-Res Residency Program for the new long-term care nurse, which was, again, expertly developed by the Center for Aging Research and Education at the world-class University of Wisconsin-Madison School of Nursing. So I'm going to start with Barb. Barb, would you provide an overview of how Geri-Res became a reality, and why is the program so important in today's long-term care industry?
Okay, happy to do that. It was a long process, a lot of thinking about it before we jumped into it. Kim and I, for years, have been involved in research studying turnover of nurses in long-term care and care quality. And a few things that we've learned that I think led to the need, clear recognition of the need for a nurse residency program, transition to practice program in long-term care, were complexity of residents now, how difficult it is to manage the really complicated problems that long-term care residents, patients bring to that they're involved in, and that the nurses need to be skilled at developing. So that's one issue. The other one is the turnover rate. That's I think everybody knows that the turnover rate of nurses in long-term care is really high. Some places up to 80, 90% a year, many more around 35 to 45, which is still way too many people to be leaving. And as we talked to nurses over the years, nurses who were still working, nurses who had left the long-term care setting, one of the things we learned was that the lack of preparation prior to taking the position and the lack of support once people take a position. Many places don't even have much of an orientation program. So if you put a new grad in a situation like that, it's a disaster. It's just a recipe for failure. Hospitals have learned a long time ago that new nurses in particular, need a lot of support to become a real full practicing nurse. It just doesn't happen on day one. We don't prepare them well enough, and it's not time in nursing preparation programs. They need a lot of coaching once they hit the floor. And so this Geri-Res was designed with input from nurses, surveyors, people at all levels of government, but also administrators, and most importantly, the nurses themselves, to focus on what do they need, what sort of support is going to be the most useful as they start their work.
Thank you very much. That's very helpful. And I'd like to also ask Kim, can you tell a little bit about the Geri-Res program and how it was designed?
So Sue, Geri-Res was designed with both flexibility and adult learning principles that aim to create a high-quality transition to practice experience for those nurses who are new to long-term care. And there are two program components. The first component, Geri-Res Clinical Coach, and then a second component, Geri-Res Nurse Resident. These two components leverage the mentor-mentee relationship to create the best learning environment for the new nurses to succeed in their roles. First of all, the clinical coach prepares for their mentor role by going through an online course consisting of 7 learning modules. And then the nurse resident goes through 12 online Geri-Res modules, 1 per week for 12 weeks. And then there are 6 optional modules that providers can choose from also. Each module takes about 1 hour and is paired with exercise, quizzes, and active learning assignments to help learners translate what they're learning online into practice. And then weekly time together between the clinical coach and nurse resident facilitates opportunities to discuss those assignments, just reflect on their week and receive feedback. And then the clinical coaches are encouraged to incorporate any employer-specific resources, guidelines, and practices into those discussions.
Fabulous. Thank you so much for that information. So as you've indicated, Barb and Kim, GeriRes has shown successful outcomes since its inception, and Pathway Health is really pleased to be able to bring excellent transition to practice training to the post-acute care industry. Do you have any final thoughts as to why an organization should invest into this type of training for their nursing staff? I'm going to start with you, Kim.
So really, I just think it's the right thing to do for nurses. It's a benefit that's going to spill over into both the quality of work life for CNAs and the quality of care for residents. And it's going to help long-term care employers remain competitive in recruiting great nurses.
Thank you very much. And Barb?
Yeah, I just wanted to, investing in GeriRes demonstrates to the nursing staff that there is a recognition that this is challenging, complex work that requires specialty knowledge. Not just anybody can do it. So it's really an acknowledgement of respect and recognition of the skills and the hard work that the nurses bring to this. And I think nurses, one of the reasons that nurses leave is they don't feel respected, they don't feel acknowledged, and they don't feel prepared. So I think those are really good reasons for an organization to invest.
Well, excellent. I would like to thank both Barb and Kim, both of you today, for spending a few minutes with us to discuss GeriRes and really to talk about how it can improve nurse preparedness for safe and competent practice, also to improve nurse retention, increase confidence, and then, of course, that lowers the cost in organizations.
Thank you, Sue, Barbara, and Kim for joining us on PATHTalks. To learn more, visit pathwayhealth.com. Until next time, keep on your path to success.